Alright, so we're going to be doing MMT for combined cervical flexion. Having your patient lying in supine, ask them to raise their head and just look towards their toes, please. That's a grade 3. And then for grade 4 and 5, using 2 fingers, you're going to ask the patient to raise their head, and then you will apply moderate to maximum pressure at the forehead. And then for a 2 and 1, for 2 you could do a partial range of motion. You could also do palpation of the sternocleidomastoid, and you could have isolate it by having them rotate to a side. And then 1 would be just activation of just that muscle. And then for trunk flexion, we'll do please raise for grade 5, you would put your hands, lightly put your hands behind your head, and just make sure your scapula would get off the table. And then you would make sure that the inferior angle of the scapula would reach off. That's for grade 5. For grade 4, please cross your arms like so, and then flex forward again the same way. You watch the inferior angle rises off. Grade 4, grade 3, you'd put your hands down like this, so it's lower to the closer to the center of gravity. Same thing, flex, please make sure that comes off. Good. And then for a grade 2 and 1, for 2 it could be partial range of motion, or it could be just palpation at the linea alba. And then for a 1, you could support the patient like so, and just ask them to cough, please cough. And that would be activation as well of the rectus abdominis. For trunk extension, actually, because he's already in supine, we'll do rotations. So now for rotation, for a grade 5, you would put your hands lightly behind your head and just flex forward and then reach towards your opposite side. That's activation of your obliques. And then for a grade 4, please cross your arms over your chest and do the same thing. They're essentially the same for flexion and rotation. And for grade 3, hands down and just rotate to the opposite side as you flex forward, like so. That's good. You will do it bilaterally. And for a 2, you could just see partial range of motion, or you would do the same thing as 3, but it would be partial range of motion. And for 1, it will be just trace. It will be just palpation. And then for extension, would you please lay in your stomach? You would ask the patient to lie in prone and hands by your side. And for cervical, they would be off the table, but first we will demonstrate extension of the lumbar. For grade 5, you could stabilize just at the ankles like so, and have them please raise your trunk off the table, sir. Perfect, good. You could also stabilize with your body weight and your forearm using at the pelvis. And that's for lumbar. For lumbar and thoracic, you would have the patient off the table, but we'll demonstrate that in a different video. Alright, so we're going to be doing MMT testing for capital and cervical extension of the head. So having your patient lying in prone, ask them to please get your head off the table, please, like so. Hands are going to be by the side. You could stabilize at the ankles or pelvis, depending on the weakness of the patient. For a grade 3, ask the patient to just lift their head off, trying to look up towards the ceiling. That's a 3. For a 4 and 5, please do that again, sir. Look up. You will put mod to max resistance. 2 would be partial range of motion, and 1 would be just palpation of the suboccipital muscles. For trunk extension, if we're doing lumbar and thoracic, you would ask the patient to please get off the table to up about your nipple. Good. And then for a grade 3, same position, hands by their side. Please raise your trunk off the table. Good. For grade 4 and 5, you would ask the patient to please put your hands behind this back of your head lightly, and once you stabilize, please extend and bring your trunk off the table. For a grade 5, it's if they could bring up their trunk and hold it without exertion. Grade 4 is exertion. 3, as demonstrated before, and then 2, it will be partial range of motion. Perhaps they just get in level with the table. For a 1, they you would just palpate on the sides of the erector spinae group to see if there's activation. Isolation is not available. And then last but not least, you could come down, have the patient lying in supine. We're going to be testing the quadratus lumborum for elevation of the pelvis. So for a grade 3, would you please hike your hip up? That's a grade 3. For a grade 4 and 5, as the patient hikes their hip up, you could provide resistance at the ankle and just mod and then max. And then for a grade 2 and 1, 2 is partial range of motion. 1 would be a trace, but a trace is unavailable due to the muscle's deep origin.